Hi, welcome to Mommas and Mannies. I'm your host, Trina. This is a short form podcast for mamas that are looking for a quick burst of me time. But before we get started, go ahead and hit the like button. Share this with another mama. And remember to check out some of our old episodes, our prior episodes on whatever platform you're listening to us now, or if you're watching us on YouTube. That's something I wanted to add a little extra for this week. As always, we're going to start the week off with a motivational quote. This week's motivational quote comes from Madam C.J. Walker, and it says, "Don't sit down and wait for the opportunities to come. Get up and make them." Again, that quote says, "Don't sit down and wait for the opportunities to come. Get up and make them." That is from Madam C.J. Walker. And I think that quote means throughout life, you're not going to be handed things. You have to go out and take. I don't want to say go out and take, but you have to make opportunities, just like she said. If it's something that you're looking to do and you feel like you're waiting on somebody to give you the opportunity to do that, go ahead and make the first step. Whether that is if you're looking for a new job, or if you are trying to, for instance, get your child into a new school or another school. I know pre-K programs around this time, it's time for enrollment. I guess if you're trying to get to another school, let's say if your child was in pre-K and they're trying to get to another school for like kindergarten, the spring, even summer camps, things like that, this is the time that they are looking for open enrollment to go ahead and start. So even something as simple as that, if you need to find out about scholarships, or if you need to get funding, or if you need to just see if they are accepting kids, go ahead and take the opportunity. Make sure you are going out, picking up the phone, sending an email, visiting that location, and make that opportunity happen. So that's the quote. But guess what time it is? It's mama time. This week's mama time, I wanted to do something a little bit different. I think this is still considered mama time, but more of a non-traditional mama time. You may be thinking, once I started talking about it, you're like, that's not mama time. I think it is, and I think it's something, especially after you have kids, or if you're getting a little older or more mature, this is something that's very important to make sure you're doing on a yearly basis, or whenever that routine checkup is supposed to happen. So preventative care. I usually do my appointments at the end of the year, but preventative care, and it can be something as simple as like an eye exam. If you wear glasses or contacts, you may have to get your eyes checked once a year. Now, every other year, you may have to do things like that. But getting an eye exam. Oh, also too, if you have history in your family of like glaucoma, cataracts, any type of eye conditions that may come up that someone in your family before you has had, you definitely want to go get an eye exam. Nowadays, they make it, I don't know if it's easier or it's more convenient to get more optometrists in the office, or to have more optometrists available. A lot of places are doing the virtual eye exams. So you can still go to your traditional optometry place, America's Best. What is the name of the place we went to? Because we don't go to Vision Works. I couldn't remember because that was our first time going there. Or just, if you go to a small optometry office. I don't know about the small offices, but I know for sure the bigger, like the franchise or the big nationwide companies, they're doing those virtual optometry eye checkups. Once you go to the actual office, they have like a tech that's doing your introductory stuff, blowing air in your eyes, reading off some of the basic things, I think like doing the night vision and other stuff like that. You do that there. But when you actually go back to do the eye exam, where you're reading the letters, they're changing the focus and things like that. A lot of times that person is not even there. So that's just something to think about. If you want to do where is an actual optometrist in the office, you probably have to act. So just keep that in mind. The next one is a dental exam. The recommended dental visits is every 6 months or twice a year. Definitely check with your insurance with everything I'm mentioning now. I think most insurance probably do the 6-month cleaning, but check with your insurance at least 2 times a year, because guess what? You only get one set of teeth. After your baby teeth fall out, you only get those adult teeth. Even now, I know some people, this is something that a lot of people do. They get like veneers and stuff like that. But still, you still got to get your teeth checked even before you get those or even after, because you want to make sure you don't have teeth that are rotting and things like that, because it can cause a lot of issues, bad breath, and just other things, gingivitis, other issues that you may have. And I'm trying to think, if you are afraid to go to the dentist, I would probably ask a family friend, a family member or a friend, do they go to a dentist? How are they? Do they make it easy? Because a lot of times they can give you something to kind of ease that anxiousness or take away some of the pain. So think about that. The next one is vaccinations. Just depends on how you feel about vaccinations. I can't say that. Vaccinations, if you want to get them yearly. I have been getting a flu shot since about 2007. I have never gotten sick from the flu shot. My husband did not get flu shots, I think, until we got married. And then the 1 year he did get a flu shot, he actually got the flu. And he was like, well, I'm not getting any more flu shots. And he doesn't. And he doesn't get sick. I don't think he's had the flu since then. So it just depends. If you are at risk, you may want to get a COVID vaccine, but just making sure you're up to date on your other vaccines, like if you've missed anything, or if you came from another country or something like that, maybe it's something that you're missing once you're here, that's important. Or that, like right now, it's a measles outbreak, I think, in Texas. So you may want to check on that if you've never had a measles vaccine. You may want to see if you've ever had one, or if you haven't, get more information about actually getting a measles measles vaccination. And then next, for us, since we're mamas, you want to do your annual checkup, like your pap smear, breast exams. If you're under 40, they recommend just doing a self breast exam, and your gynecologist would actually do that as well. But if you're at high risk, you can still request a mammogram. Again, talk to your insurance company. It just depends on what pricing is like, how much they'll pay, if it's going to be covered. Speak with your insurance company on that, because I know sometimes they don't want to pay for a mammogram if you're not 40. So if you're over 40, it should be included with your insurance. That's the annual thing that comes up. So please look into that. And other places have, they do like mobile mammograms all the time. So look into that too. I think with the mobile mammograms, they still may reach out to your insurance company, but some places may be doing free mammograms. Early detection is the key. Next, we have colonoscopies. I do not know what the age is for a colonoscopy. Same thing though, everything that I'm about to go over now, if you have any family history, you may be able to get it done before that age. Let me see if I can look real quick, because I know, let's see, colonoscopy, just to see. Okay, so the recommended age for colonoscopies for individuals at average risk of colorectal cancer is actually 45 years old. If you have, that's with no risk. And then if you are at risk, speak with your doctor. They may want you to get it done more often or earlier than 45. Then it says you only need to get it done every 10 years. Again, I'm going to keep saying this. Insurance can be really tricky. Check and see what's covered. And you know what? If your insurance does not cover, see if you can do it out of pocket. See how much that costs. If you can go to like a smaller clinic, or maybe your hospital has some type of program where they do free screenings more often if you aren't that particular age, but you're at higher risk. The next one is going to your primary care physician. I do that again at the end of the year. I started going to a doctor's office, but just seeing like the nurse practitioner. They have more appointments. It's a lot quicker. I don't have to wait that long. But just getting your average tests like your CBCs, your CMPs, and that's basically checking for your glucose and your other levels. I was trying to think of what else. Another big one is to make sure you do like your A1C. That way you will know what your risk is for diabetes, making sure you're not pre-diabetic, making sure you don't have untreated diabetes. So you want to make sure that you get that checked as well, getting your blood pressure checked. Now, with your blood pressure, of course, you can go to the doctor, but also when you go to like the pharmacy, even I know for sure Sam's has it, some Walmarts, they have those chairs where you can check your blood pressure. Like Walgreens and CVS, close to the actual pharmacy desk, they have where you can check your blood pressure. So if you have anyone that's in your family with high blood pressure, you may want to do that once a month, every other month, once a quarter, just depending on your risk. And getting your cholesterol checked, that's something you would also do with your primary care physician. They would do a lipid panel that takes and measures all of your cholesterol related numbers, LDL, HDL, what is the VLDL? I think that's actually a calculation, but just making sure you don't have high cholesterol, because that's something that affects other stuff. Let's see what else we got. So cancer screening, blood pressure and cholesterol, glucose. I talked about vaccinations. Leave a comment below and let me know if you get something else done. Or even like if you like to go to the chiropractor once a year just to get an alignment. I was trying to think of some other stuff, but definitely for mamas, mammograms if you're over 40. If not, making sure you're doing your annual checkup with your gynecologist to get your cervical cancer screenings, getting your breast exams, doing your self breast exams on a monthly basis, just making sure you're taking care of yourself. This is not your traditional mama time, but I think it's great to talk about, especially at the beginning of the year, because you want to go ahead and set that intention to get those screenings done now. Let's say if it takes you, especially if you go to a doctor that's pretty popular, it may take you until April or May to actually get an appointment. So think about that. Let me know if you do something else on an annual basis that I missed besides the eye exam, dental, vaccines, the primary care physician, gynecologist. I was trying to think. I think that's about it, but I would love to hear your comments on what you get checked, what you work on. Oh, and I forgot about, yeah, I did say blood pressure, but what do you work on? What do you make sure that if you have someone in your family, you're at a higher risk, that you keep an eye out on? For me, I like to keep an eye out on my cholesterol levels. Since I work at a hospital, I actually get my blood drawn and check them once a month just to make sure. And another great thing to do if you get these not vaccinations, if you get these checks done and you find out that you are at risk or you have higher than average numbers, do the research. Speak to your doctor and say, hey, what can I do to get these numbers down? Let's say you go to the doctor and you have a high A1C. It's like over 5.5. Speak with your doctor. What can I do to get my A1C down? You know, use Dr. Google. Not necessarily saying you got to take everything you find on Google to heart, but seeing, are there some diet changes you could do? If your cholesterol is high, is there something that you can do on your own? Definitely do the research, speak with the doctor to make sure you're not doing anything to harm yourself. I was trying to think of something else. I think that's it. Because we talked about getting the exams. And then I talked about if you find out basically what happens next, speaking and making a plan to get those numbers down. Here's another thing. If you don't check your weight on a regular basis, you definitely want to do that too, just to stay healthy. Because a lot of these things can be decreased with, like, risk factors can be decreased with losing just a few pounds. Just depends. You really have to look in the mirror and say, am I healthy as I want to be? Especially if you have young kids, like under the age of 10, under the age of 5, especially, you want to be around for them, be able to play with them. You don't want your kids out running around and you can't be out there with them having fun. Think about that, because spring break is coming up. So if you find yourself during spring break and you're like, ooh, I'm out of breath. Ooh, I can't keep up. Go get your numbers checked. Maybe it's something else. When you have higher cholesterol numbers, it can make you feel winded. It can make you feel out of breath. So just take this particular episode to heart. Share it with another mama. Please share, share, share. That way, especially this episode, because it's not your traditional mama time, but it's a great way to talk to a family or a friend that you are concerned about their health. That way, I'm saying it and you're not saying it. So think about that. Share the episode, hit the like button, hit the bell for notifications so you can know when we come out with new episodes, new reels, new shorts. Follow us on all social media platforms at Mommas and Manny's. And of course, check out our YouTube channel and leave a comment to let us know what checkups you're going to this year. Even if you're going to them next month or you already have a checkup plan, would love to hear that. And as always, remember that me time is essential and it is never selfish. Have a great week, mamas.